In healthcare, change is about acknowledging that there are better ways to do things, then working together to find those new solutions. And it's about fostering a different attitude or culture while keeping the focus on providing the best care possible for our patients. Let's take a look at just a few of the exciting success stories being written in Saskatchewan's health regions. For the past 5 years, health providers working in the intensive care unit at Saskatoon's Royal University Hospital have been working collaboratively to increase quality of care by reducing patient complications. Through its Quality of Care initiative, the ICU team is monitoring complications on a daily basis, talking openly about them as a team every 15 days, and taking corrective actions to improve health outcomes for their patients.
The information we're gathering is related to things that happen with patients, usually in the last 24 hours. And so what we're doing is looking for any kinds of complications that may have occurred, whether they're disease-related, patient-provider-related, or equipment-related. It's important to gather the information and to put it all together so that we can develop a sense of what kinds of things happen to patients, whether there's something we can do to prevent or change those things that happen to patients, and to get a sense of how frequently it happens. So one of the things that we're looking for is trends. So that's why we collect and collate the data, and then we analyze it and present it every 2 weeks in an interdisciplinary group. And that's where we determine what action we might be needing to take to correct the problem or prevent it from happening to other patients in the future.
Quality improvement often requires a change in attitude and culture. When it comes to learning from errors, that means moving past finger-pointing and blame to nurture an open, honest climate.
Well, in regard to the error that can be produced by omission or commission, it's very well known now in the world that this is an important part of the professional activities in the healthcare. And one of the most important things that can be conveyed through education is that any mistake or error, it has to be pinpointed, analyzed, and with intent to improve without having anyone feeling, chastised or unduly criticized. The intent is to improve, for the future and not to repeat the mistake.
We've had a real commitment to moving towards the concept that if an error occurs, it could happen to anyone. So we're really not interested in who or what staff member was there when the error occurred. We just assume that if it happened once, it could happen again. And I think with that change in attitude, people have become much more open about discussing complications that occur.
Intensive care involves a broad range of health providers, each bringing their unique skills and expertise to the bedside. Little surprise then that all members of the team help track complications during daily rounds and offer their unique observations and perspectives during twice-monthly team meetings.
I think it's extremely important to involve the different disciplines. They all bring a unique focus. I think each discipline brings their own strengths to the rounds, and that's what really makes it a unified group.
The team approach and cooperation of the different professional groups that work in ICU is fundamental. Here we have, physicians, nurses, and respiratory technologists, physiotherapists, pharmacists, dietitians. All of them have contributed or continue contributing with their ideas and their input for the overall assessment, evaluation, and action on quality of care. This program is working because of, number one, the combined effort of a multidisciplinary team. It has been an enthusiastic participation of every of the professional group that work in the ICU to contribute in making the program progressively better.
Successful change requires committed leaders to champion the cause, to keep the team focused on the goals of the process.
It has to be a physician champion, it has to be nurses champion, it has to be anyone working and with enough enthusiasm to be participant of that is a champion, and the function of a champion is to keep alive the education about whatever improvement is being sought. The lesson that we have learned across these 5 years we have been working is that in order to have, you see, the participation, the cooperation, and the understanding of the group as a whole, you need a constant reiteration of, from an educational point of view, of what's important on in improvement in quality of care.
In the Five Hills Health Region, patients taking the blood-thinning medication warfarin are experiencing fewer side effects thanks to a program in which hospital pharmacists oversee the use of this drug. More than 500 patients in Moose Jaw and surrounding area have their blood work monitored and their dosage of the medication adjusted through the region's warfarin management program. Such changes often start with the recognition of an opportunity for improvement.
We started our program looking into having a warfarin management program back in 1999. We were noticing back then that there were a number of patients who were coming to our emergency department who were having untoward effects, i.e. bleeds and side effects from the drug they were taking called warfarin. We were wondering maybe if the patients were being monitored closely, and we checked with some physicians, and some of the GPs felt that perhaps some of the patients were falling between the cracks. They weren't maybe going to the laboratory as often as they should to get their INRs checked. And so then we looked at it and decided that perhaps there was maybe a better way to look after these patients' care. We sort of set up a committee and decided, well, why don't we try it? We got administration's support. We found some dollars. We prioritized, and we started slow.
The Chief of Medical Staff for Five Hills was an early champion for the program. He recognized the benefits of transferring responsibility for drug management from busy physicians to hospital pharmacists. Before the program, physicians were often forced to make decisions about dosage changes on the fly. Now these decisions are made by pharmacists who have ready access to key patient information, including their previous test results and a list of their other medications.
Some of the benefits that physicians saw almost immediately is they weren't spending a lot of their day in making telephone calls to patients and adjusting their warfarin levels, and that really helped them to get on with other management with their patients. We had some immediate interest from a few physicians. Other physicians were a little more skeptical and a little more careful in suggesting that this was all a good idea. But once we started some pilot projects and we started a pilot office to work in and started doing some long-term care initiatives, then the interest grew. And in fact, in fairly short time, there were some physician clinics that wanted to come on board and be a part of the program.
A patient's care team often involves many different providers. The warfarin management program is no exception. Close communication and collaboration are key to improving the quality of care for patients.
Yeah, this program definitely demonstrates teamwork and collaboration, collaboration between the GP, the primary physician, the internist, who often is initiating physician who starts the warfarin, depending on the disease process. We're also involved with the local pharmacies. We're involved with home care, and of course, it's all focused around our patient.
Another difference, though, was the communication between physicians, pharmacists, and the patients. It really created a real good triangle where the patients were still seeing their physicians for follow-up care, but it was one less thing that the physician had to track. And with this tracking came safety. So it was a real win-win situation for physicians and patients.
Improving quality is also about empowering patients to become informed, active participants in their own care.
We talk to the patient on a one-to-one basis every time they have the laboratory work. And through that, with the one-to-one contact with the pharmacist, there's an educational component going on all the time. And I do believe from this program, we are really empowering the patient to understand his disease process and why warfarin dosing is so important to their health. They are our focus. We're trying to make their health better, and through our program, I think they are also making their health better.
The program is improving quality of care for patients on warfarin. Proactive monitoring and dosing by program pharmacists is keeping patients' test results on target. So Five Hills is seeing fewer patients in the ER with medication-related bleeding or bruising. And patients themselves consider the program a winner.
I know you were one of our first supporters. Your clinic was one of the first supporters of the program, and in return, we did put your patients on immediately when we started the program. But since then, there are patients of yours and other physicians that are on the program. They talk to their neighbors, and a neighbor will say, "Jeepers, I'd like to do that. How do I get that?" Well, talk to your doc. He knows about it. The patients are very happy with the program. They get the results. They come in and get their laboratory work taken within hours. They're phoning us wanting their results. We did a satisfaction survey this past summer, and the program is rated extremely high. We just don't have patients leave the program.
I like it because you have more contact with a pharmacist instead of having to phone my doctor's office and get a result. The hospital will phone me, give me instructions straight away so that I can just carry on.
At Pineview Lodge in the Kelsey Trail Health Region, an exercise program is improving the quality of the caring experience for employees by reducing workplace injuries and boosting staff morale. Warm Up to Work is a short stretching and strengthening routine done by caregivers and other staff at the beginning of every shift to prepare their bodies for the work ahead.
The Warm Up for Work exercise program is a program that we started back in 2000, as we were seeing a lot of workplace injuries, some strains, just some minor injuries, but a lot of major injuries that were increasing our workman's comp claims. So we started this program. We felt that this might reduce the number of injuries that we were seeing.
It actually originated with a group of employees that sit on a long-term care committee, and they were tracking the rate of injuries or near misses, sort of minor injuries that people were seeing at the end of their shift. And they wanted to do something about it. So they asked if I would provide this exercise program so at least they could limber up at the beginning of the shift and hopefully prevent some of these injuries.
An opportunity for change presented itself in the form of an amendment to union contracts that created a 15-minute overlap in shift changes. The result? Found time for staff to limber up as part of their paid working day.
We had tried it once before. The time before when we tried it, it was optional because it wasn't on paid time, and it really didn't fly. People didn't want to come to work early and stretch on their own time and then work. So we decided it would be on paid time, and there would be no options as to whether you did it or not. It would be part of what you did when you worked here. They thought we were crazy. Well, this isn't going to work. This is a waste of time. They really thought we were a bit crazy, but it wasn't long before they were saying, you know, I do feel better. You know, I didn't used to be able to bend my leg up like that, and now I can.
The activity coordinator at Pineview Lodge is a believer. Before Warm Up to Work, Eleanor Anderson was making regular visits to a chiropractor for arthritis and nagging problems with a sciatic nerve.
My experience with the stretch program or the exercise program that I have been doing for the last, I believe it's about 3 years now, is I can honestly say that I have no pain. I have never been to see the chiropractor in the last 3 years, or a massage therapist, or an occupational therapist. I firmly believe in the exercise program. I really don't think for myself there's words that can describe to anyone how it has affected me personally. Like it's just wonderful.
Successful change is about commitment. The champions for change must believe, really believe, that an initiative or program will make things better.
I think it's worked here in Pineview because we really believed that it was going to work. We really believed that if we had our staff do the stretches, that they would feel better and there would be improvement. Management have been very supportive with this program and actually are trying to encourage other areas to incorporate the program into their workday because the results have been really good for us.
The staff have been enthusiastic about it, and they participate in it on a daily basis at the beginning of their shift. If you don't have that employee enthusiasm, it won't work.
And the benefits are obvious.
So, and what we've seen since we started the stretching program is there's been a big reduction in the number of workman's comp claims.
Well, as a physiotherapist, I have seen fewer staff members coming to me for therapy, which is a positive thing. But just general stories in the hallways is that staff are feeling much better doing their job. They're feeling like they're able to go the distance, being able to fulfill their duties at work. And they're going home feeling fresher because they're not being strained at work.
But it's not just staff who reap the rewards.
But I think it's that whole caring thing. The caring starts with management caring for the staff, and then the staff in turn will care for the residents in a broader sense than we used to before.
Physically, it's helped me. Mentally, it's helped me. Mentally, I'm just all ready to go to work in the morning when I finish my exercises. I can just go down the hallways and like it's a new day.
These are just 3 examples of the exciting initiatives underway in Saskatchewan. They have enhanced quality of care, and they have created support and enthusiasm for more positive change in the future.
So I think the key issue is the team approach and the education that the team receive from time to time.
In addition to communication, I think it has really shown that where several disciplines get together, that they really can make a difference. And I think that going forward, we're going to be able to further enhance care using teamwork like we have in this particular instance.
And in fact, we have blown our own horn a bit at meetings when we've had regional meetings and we talk about quality improvement things, and we always say, well, this is what we do at Pineview and everybody else should do it too. I think they get fed up with hearing us, actually.
Throughout Saskatchewan's health system, there is commitment to improving both quality of care and the caring experience for patients and for providers. Momentum for change is growing. Change for the better.